Assalamu alaikum students. Today our topic of discussion is diffusion of gases through the respiratory membrane. So firstly, what is a respiratory unit? Respiratory unit includes respiratory bronchioles, alveolar duct, atria and alveoli. And there are 300 million alveoli in the two lungs, having each alveolus a diameter of 0.2 millimeter. And there are capillaries around the alveolar wall where the gaseous exchange occur. And these capillaries are in close proximity to the alveoli. So further, the gas exchange between the alveolar air and the pulmonary blood occurs through the membrane of all the terminal portion of the lungs, not merely in the alveoli themselves. All these membranes are collectively known as respiratory membrane, also called the pulmonary membrane. And this is the diagram of a respiratory unit. You can see the terminal bronchioles, respiratory bronchioles, and then alveolar ducts, and alveoli and atria and alveolar sacs. This whole is your respiratory unit. Now what is the respiratory membrane? You can see here there is a first layer on the left hand. This is the fluid and the surfactant layer, and then is the alveolar epithelium, and then is the epithelial basement membrane, and you can also see here the interstitial space, and then is the capillary, and these are there are actually total 6 layers, and you can see here the red blood cells. So the respiratory membrane consists of a layer of fluid lining the alveolus and containing surfactant that reduce the surface tension of the alveolar fluid, the alveolar epithelium, and the epithelium basement membrane, and a thin interstitial space between the alveolar epithelium and the capillary membrane. And then is a capillary basement membrane, and then capillary endothelium. So these are the 6 layers. You can see here also as well the capillary basement membrane and capillary endothelium. A capillary endothelium in red. And the overall thickness of respiratory membrane averages 0.6 micrometer and as little as 0.2 micrometer. And the average diameter of pulmonary capillary is only 5 micrometer. So the red blood cells squeeze through the pulmonary capillaries, and they also touch the capillary wall, so that the oxygen and carbon dioxide need not to pass through the significant amount of plasma as they diffuse between the alveolus and the red cells. This too increases the rapidity of diffusion. And factors that affect the rate of gas diffusion through the respiratory membrane. Number 1 is the thickness of the membrane, then surface area, then diffusion coefficient of the gas, and then partial pressure difference of the gas between the two sides of the membrane. So thickness. Firstly, as the thickness increases, for example in fibrosis, the diffusion decreases. And the second is the surface area. When there is a decrease in surface area, for example during emphysema, when there is collisions of alveoli, or there is a decrease in the number of alveoli, the surface area is decreased, and this decreased surface area also decreases the diffusion. And then third is the diffusion coefficient. Diffusion coefficient actually depends on the gas solubility in the membrane, and inversely on the square root of gaseous molecular weight. So therefore, for a given pressure difference, carbon dioxide diffuses about 20 times as rapidly as oxygen. Oxygen diffuses about twice as rapidly as nitrogen. So all the weight matters regarding when we discuss about the diffusion coefficient. And the pressure difference across the respiratory membrane, when there is more pressure difference in the alveolar side, in case of oxygen, when there is more pressure of oxygen in the alveolar side, it moves from alveoli to blood, and likewise opposite is the case with the carbon dioxide. Carbon dioxide moves from your blood into the alveolar bed. So it is vice versa. It all depends upon the pressure. The pressure of oxygen is more in alveoli, while the pressure of carbon dioxide is more on the tissue side. And diffusion capacity. The diffusion capacity of for oxygen under resting is 21 ml per minute, and the mean oxygen pressure difference across the respiratory membrane during normal quiet breathing is about 11 millimeter of mercury. Multiplication of this pressure by diffusing capacity 11 gives a total of about 20 to 30 ml of oxygen diffusing through the respiratory membrane each minute, and this equals at which the resting body uses oxygen. So change in oxygen diffusing capacity during exercise, during strenuous exercise or other conditions that greatly increase pulmonary blood flow and alveolar ventilation, and diffusing capacity for oxygen increase in young men to maximum of about 650 ml per minute per millimeter of mercury, which is 3 times the diffusing capacity under resting condition, which is 21 ml per minute per millimeter of mercury. This increase is caused by several factors. Number one, opening up of many previously dormant pulmonary capillaries or extra dilation of already open capillaries, therefore increasing the surface area of the blood into which the oxygen can diffuse. And number two, a better match between the ventilation of alveoli and the perfusion of alveolar capillaries with the blood, called ventilation perfusion ratio. We will discuss this concept in the coming lectures. So these are the two factors which increase the diffusion capacity of oxygen during exercise. And diffusing capacity of carbon dioxide. The diffusing capacity for carbon dioxide has never been measured because of the following technical difficulty. Carbon dioxide diffuses through the respiratory membrane too rapidly that the average partial pressure of carbon dioxide in the pulmonary blood is not far different from the partial pressure of alveoli. The average difference is less than 1 millimeter. So the diffusion coefficient of carbon dioxide is slightly more than 20 times that of oxygen. So one would expect that it can be 400 to 500 ml per minute per millimeter of mercury during exercise, and that is the value of during rest, and 1200 to 1300 minute per millimeter of mercury is for exercise. You can see here. In case of carbon dioxide, at rest 400 in red and about 1200 in blue. But these changes are very little in case of oxygen and carbon monoxide. So, measurement of diffusing capacity, the carbon monoxide method. The oxygen diffusing capacity can be calculated from measurements of alveolar PO2 in the pulmonary capillary bed, and the rate of oxygen uptake by the blood. So, there is a difficulty in measuring the diffusing capacity of oxygen directly. So there is an indirect method by measuring the diffusing capacity of carbon monoxide. So firstly, the diffusing capacity of carbon monoxide is measured, and the method, the principle of carbon monoxide method is the following. A small amount of carbon monoxide is breathed into the alveoli, and the partial pressure of carbon dioxide in the alveoli is measured from appropriate alveolar air sample. The carbon monoxide pressure in the blood is essentially zero because hemoglobin combines with this gas so rapidly that its pressure never has time to build up. So the partial pressure of carbon monoxide in the blood is zero. Because it has no time to build up. Therefore, the pressure difference of carbon monoxide across the respiratory membrane is equal to its partial pressure in the alveolar air sample. Then by measuring the volume of carbon monoxide absorbed in a short period and dividing this by the alveolar carbon monoxide partial pressure, one can determine accurately the carbon monoxide diffusing capacity. 2. Convert carbon monoxide diffusing capacity to oxygen diffusing capacity. The value is multiplied by a factor 1.23 because the diffusing coefficient for oxygen is 1.23 times that of carbon monoxide. Thus, the average diffusing capacity for carbon monoxide in young men at rest is 17 ml per minute per millimeter of mercury, and the diffusing capacity for oxygen is 1.23 times this, or 21 ml per minute per millimeter of mercury. So you have to multiply 17 with 1.23 because the diffusing capacity is actually the diffusion capacity of oxygen is 1.23 times more. So the diffusion coefficient of oxygen is 1.23 times that of carbon monoxide. So this is all about the respiratory unit, the respiratory membrane, and the diffusing capacity of oxygen and carbon dioxide, and how we can measure the diffusing capacity of oxygen by measuring carbon monoxide method. And what are the factors that affect the rate of gas diffusion? There are 4 factors. So this is the important lecture, and this diagram is actually very important, this one. So you have to memorize this diagram.